the meeting. Okay. All right. So today we're going to talk about the nervous system and just touch a little bit on behavioral health. This book doesn't go a whole lot into it just because there's not a lot of terminology with that. But let's see here. There we go. All right. So the nervous system, you guys know, you feel all over your body, so you know we have nerves all over our body. And there are over hundreds of nerves that are listed in our body. Of course, this is not an anatomy and physiology class, so we're not going to worry about learning all of them. But this is a pretty cool picture because it does show the main ones, and you've got to figure for every main nerve, there are at least 10 little tiny nerve branches that go out of it, which is pretty cool. Okay, so the central nervous system. It consists of the brain and the brainstem, the spinal cord, and then the cauda equina. The cauda equina is the nerve bundle that goes down to our legs, okay? So as far as the brain goes, okay, oops, let me go back. As far as the brain goes, it's got the ventricle, which is that blue area in the middle, okay, the blue area in the middle, the cerebrum, which surrounds it. The cerebellum is at the bottom of the base of our neck, excuse me, at the base of the skull, at the top of the neck, okay? And then the brainstem has the medulla oblongata, the midbrain, and the pons, that's in our neck. Then we've got the spinal cord and meninges, and then the cauda equina. So it's very simple when we look at it. It's just divided into, the nervous system is divided into two things. The central nervous system, which is the brain and spinal cord, and then the peripheral nervous system is everything else, okay? So it's pretty simple. So we talked a little bit before in the previous slide about the ventricle, the cerebrum, and the cerebellum. And I show you this. This is kind of like if someone cut the brain in half from top to bottom. The ventricle is the most protected part, okay? The cerebrum is protected, but it's only protected by the bones of the skull. So the ventricle is super protected, and the cerebellum is not nearly as protected as the rest of the brain because it's right at the bottom of the back of your head. So I just kind of like to show you this as a cross-reference so you can kind of see how protected the ventricle is. The brainstem is consists of the midbrain, the pons, and the medulla oblongata, and part of the cerebellum. So the brainstem, and the reason I include this is just to give you a little bit of background. The brainstem, if a person is injured anywhere in the brainstem and it's a real snapping injury, usually it's fatal because everything is severed. Okay, so it used to be people when they didn't wear seatbelts in their car and their head snapped really bad, and they literally, quote unquote, broke their neck. It's because everything got severed at this point. So this is a cross-section of the spinal cord showing the layers of the meninges. And of course, you don't have to know this anatomy slide, but I like this slide because it shows you how intricate the meninges are within the spinal cord and why spinal cord damage can be minimum. Sometimes people have a slight bruise to their spinal cord and sometimes they have a real severe injury. So if only one tiny part of this is injured, it's fixable, or the other parts can compensate for it. But when there is a severe severing of part of the spinal cord, these are all the things that get affected. So it's not just the nerves, it's the nerve roots and the gray matter and the pia matter. So it's just kind of to show you exactly how intricate each one of our meninges in our spinal cord are. So as far as the cranial nerves, you aren't going to need to know this slide. I just love this slide because it shows you which part of the brain goes to which part of the nerves in the body. So say you have a brain injury in the very front of your brain, okay, in this area, okay, if you follow the trail, those are the olfactory nerves. So you're going to have trouble with your smell and your taste, okay? If you have a problem with, in the center portion of your brain, you could have a problem with your facial nerves, with your ears, okay, with swallowing, with the back of your throat. It just is a really interesting depiction of how when a different part of the brain is injured, it doesn't always affect the whole body. Okay, so let's start with some suffixes. Iatrist is a specialist, okay, we know that. Iatry is a treatment. Ictal means a seizure or an attack, and paresis means slight paralysis. So if you go to a psychiatrist, you are seeing a specialist of the psyche or the brain, okay? Psychiatry is the treatment of the brain, the specialty that treats issues within the brain. So and this is another thing that drives me nuts in medical terminology. Myelo, okay, in chapter 15 refers to the spinal cord, okay? But last week we learned that it refers to bone marrow. So usually you will be able to take the context out of where it is. So it could say myelomeninges, and you know it's part of the spinal cord, okay? And then another thing is the suffix paresis means slight paralysis, while the suffix plegia means paralysis. And we're going to get a little bit more into the different types of paralysis later in this chapter. Okay, so this is a tumor composed of the developing, my internet connection is unstable. Can you guys still hear me?
Yeah.
Okay, I don't know what's going on. I think too many people are on the computer in my neighborhood today. This is a cross-section of the brain, and this is a tumor inside the glial area, okay? So this is a glioblastoma. Oma means tumor, okay? Glia is the area, and blast means beginning. So this is a tumor that is right inside the middle of the brain, okay? This is a meningomyocele, okay, or a meningomyocele. You'll see it pronounced different ways. And this is when part of the spinal cord is rupturing outside of the body, okay? So this is what it looks like when a baby is born with spina bifida, okay? So the skin and the spinal cord have not completely encased the meninge of the spinal cord. So this is what it looks like when the baby's born. Okay, so they do surgical procedures now to fix it. 100 years ago, if a baby was born like this, typically they passed away. But in today's day and age, we have some surgical procedures where they can at least graft over that. Now, it all depends on how bad the damage is, but this is, again, what spina bifida looks like when a baby is born with it. All right, so this is a pretty fun word, okay? Sphenopalatine ganglioneuralgia. All this means is brain freeze, okay? Remember, if we go backwards with the word, algia means pain, neuro means nerve, okay? Ganglio is the ganglion, So nerve pain of the sphenopalatine ganglion, this is what happens when you eat ice cream too fast or eat any frozen food too fast. You have a nerve that gets set off, but we commonly call it a brain freeze. I just like to put fun things in every once in a while. Okay, so this is kind of if we slice the head from top to bottom, okay, and I'm looking at the front half of the skull, okay, this is what a brain bleed looks like, okay. It's a bruise, it's a hematoma, so it's a bruise in a brain, and that means it's under the dura mater. Obviously there's no big cut and it's not oozing out, okay. So a brain bleed can be little or it can be big. But this is what a subdural or below the dura hematoma looks like. This is just obviously just a graphic, but this is what they can see when they do an MRI or a CT scan. This is another type of injury to a nerve. This is Bell's palsy, okay? This is when someone's eye cannot stay open. It's involuntary, okay? So Bell's palsy is when one of the optic nerves is affected, okay? It is obviously an eponym because it was named after Dr. Bell, who figured it out about 150 years ago. But people who have Bell's palsy, sometimes it'll reverse. It's a very strange phenomenon. But if you encounter a patient and their eye is twitching or their eye keeps closing and opening and closing, it's probably an indicator that they have Bell's palsy. Okay, so dementia, okay, when we talk about disorders of the brain, okay, we talk about different kinds of dementias, all right. Alzheimer's disease is a type of dementia, okay. There's another type where if there's a vascular or multiple infarct dementia, that's where the brain suffers an anoxic period where it's not getting any oxygen. There are Lewy body dementias. Parkinson is considered a type of dementia. And then there's something called Pick disease. It's front temporal dementia. It only affects the front temporal lobe. Then there are a couple different kinds of less forms of dementia. There's hydrocephalus. There's Wernicke-Korsakoff syndrome. It can happen from infections, believe it or not. And there can be tumors and chronic subdermal hematomas. So the book lists all the different kinds of dementia. Obviously, we can't get into them, but most of them are named after somebody, usually the person that discovered it. So as far as Alzheimer's brains go, you really can't do a lot of diagnosing until the patient is dead and they do an autopsy and actually look at the brain. They diagnose Alzheimer's based on the symptoms, okay? But what they have found is when they do autopsies on patients that they have diagnosed with Alzheimer's, okay, it looks like the brain on the bottom. Now you can see the brain on the top is a normal brain. It's a lot bigger than the brain on the bottom, okay? And you can see on the brain on the bottom, there are sulci, okay? The grooves are much wider. So this groove is much wider than the grooves on the top brain, okay? And then the folds in the outer brain they're called gyrus. The different gyri have shrunk. So they know that there is a physical change in the brain with Alzheimer's. They just can't explain why or what happens. Any questions about that? All right, shingles is another disease of the nervous system. Shingles happens when someone has already either had varicella or chickenpox, or they've had the varicella or chickenpox vaccine. Shingles follows nerve paths, okay, which is why it usually only affects one half of the body. It will follow the nerve path along half of the body. And this is, again, just a pictorial depiction of it, but it usually starts either in the front on the lower abdomen, or it starts on the back, but it can start anywhere. Okay, but as you can see, it doesn't cross over the spinal cord usually. So usually that's why if somebody comes in with a rash on half of their body, and it's very painful, then we are pretty good at diagnosing that it is shingles. Okay. This graphic depicts the different causes of a stroke. Okay, there's 4 ways somebody can have a stroke. Okay, so there's a hemorrhagic stroke, and that's from a rupture. Okay, there's 2 types. There is a subarachnoid hemorrhage, so this occurs right under the arachnoid. Okay, and it's usually, okay, the blood vessel has completely ruptured. Okay, so it's right under the skull bone. Whereas an intracerebral hemorrhage, and I think I've blown the intra versus inter to you guys. So this is within the brain, within the brain hemorrhage. Okay, so there's a ruptured blood vessel somewhere in the brain. Okay, so those are 2 hemorrhagic, hem, blood, bleed. Okay, and then there's an ischemic stroke. An ischemic stroke involves either a partial clot, okay, where the cerebral thrombosis, where there's a couple different clots, they stick together and they block the vessel, or a cerebral embolism. And this means that the clot probably occurred somewhere else in the body and it got much bigger, okay, and it completely blocked the blood vessel. Okay, so you can have strokes from bleeding, and you can have strokes from blood not getting there. And that's what the ischemic stroke is. Blood doesn't get there. Okay, does that make sense to everybody? There's 2 different kinds. Okay, so the general term given to a group of neurologic disorders, all characterized by abnormal electrical activity in the brain, is called epilepsy. Okay, so this is that's epilepsy. Epilepsy can occur at any age. It tends to start when they're young. Okay, so when there's abnormal electrical activity in the brain, that's what causes the seizure. Okay, sometimes the seizures can be very infrequent. Sometimes they can occur 40 times a day. Sometimes they can be very mild. Sometimes they can be very severe. We've made great strides in the medicine that we can give to prevent frequent seizures, but people who take medicines for epilepsy have to have the levels monitored quite frequently. And with children, that presents a problem because they're growing. So as children grow, their medicine level has to be checked quite constantly. Okay? So now we're going to get back to some basic medical terminology, what I like to call. Okay, so if someone has an incision into the nerve root, this is, again, the meninge of the spinal cord. Okay. A radicotomy means the nerve root has been cut. Okay. A rhizotomy can also mean that the nerve has been cut. Sometimes this occurs by accident. Sometimes it is a surgical procedure which is done to alleviate pain in a certain area of the body. The trouble with this procedure, though, is once you eliminate the connection, okay, a lot of people have to weigh, do they want to feel the pain or do they not want to feel that area of the body at all? That makes sense. Okay, so diagnostic imaging that's done for the brain and the skeletal nervous system, they can do cerebral angiography, Okay, that's where they inject dye and it fills the brain and they can take pictures. They can do CT myelography, again, where they will inject dye into the myelogenous region or the spinal cord, and they can get a lot of pictures that way. They can do an electroencephalogram or an EEG, and this measures the electrical activity in the brain. This is one of the ways they determine brain death. It's another way they determine success of a surgical procedure to the brain. So this is an example of a cerebral angiogram. So they've injected dye, okay, and so the brain matter takes up the dye, but the brain vessels don't, which is very cool. So you can read and see if the blood is circulating through the vessels or if there's a tumor or if there's an occlusion, but it's actually a very cool procedure. Okay. So this is a cerebral angiography. Okay. So this is us looking at down the spinal cord. Like if you chucked my head off, okay, and you were looking down my spinal cord, this is what you would see, okay? You can see there's an L here. That's the left side of the spinal cord. So this infers that that other side is the right, okay? And this is a myelography, okay? It is the process of looking to see what's going on in the spinal cord. And this is actually a really neat picture because you can see on the left side, okay, there's still nerve going out to the side, but you can see on the right side, there isn't nerve going out. So there's obviously been something that's happened to that nerve. I just like to include fun pictures so you can actually see and put some things in, but this is a myelography. So they can do the whole spinal cord, but usually they're looking at a specific area. They're either looking at the top, the middle, or the bottom. So this is what happens when you have a lumbar puncture, okay? The spinal, you're laying on your side, okay? And if you have to have a spinal tap to check for, usually this is done to check for, oh my God, I'm blanking. Oh my gosh, I can't believe I'm blanking on this. It's when you present with a fever and a stiff neck, and all college kids that go away to college have to be vaccinated against it. Oh my gosh, I can't believe I'm blocking on it. Oh, meningitis, duh. Okay, so they find the L4, L3, L4. So this is the lumbar 3, lumbar 4 vertebrae, okay? They have you on your side, and here's the needle, okay? So they are going between, they go between the two vertebrae, and they go into the spinal cord and pull out some fluid from in there, okay? So it's not exactly a pleasant experience. I've never had it done, but I've been present when many patients have had it done. But if there's an infection in the spinal column, they can find that out. If there's been a bleed, they can find that out. They can tell a lot of different things about the fluid going on, if there's a disease, if there's cancer cells in it, that type of thing. Okay, so that's a lumbar puncture. Okay, this is a PET scan. And when they do a PET scan, this is when they give you a radiographic isotope. Okay, so they inject you with a dye, but it also has a radiographic isotope. And you usually have to sit for about 30 minutes to 60 minutes, and it circulates through your body. Any cells that are cancerous, for some reason, we know they will take that radioactive isotope up, okay? Then they do a tomography scan, which is similar to a CT scan, okay? The only thing that's different is we've added that radioactive isotope, and that's why it becomes a positron emission tomography. So this is a tumor. The red area is a tumor in the spinal cord, okay? Anywhere that there's red, it took up the radioactive isotope. Okay, so hematoma, okay? Anything that's pertaining to below the dura mater, okay? So we have the brain, and then we have that lining right inside of it, which is the dura mater. Anything that's below that is considered subdural, okay? So you'll hear the word subdural most of the time referring to a hematoma or a brain bleed. Now, patients tend to freak out when they hear that, but this is what a common concussion is too. Okay, usually the brain bleed is just very little with a common concussion. It's when it's a big hematoma that they may have to do some surgical procedures to relieve the pressure. But usually if it's just a tiny brain bleed, they will just try to let it resolve on its own. All right, so now we're going to look at esthesio, which is sensation, sensitivity, or feeling. So the word anesthesia comes because we have the prefix "an," okay? "An" means without. Oh, here we go with my interconnection again. So anesthesia means without feeling or sensation, which is a beautiful thing when you're having surgery, okay? Whereas dysesthesia means, dys means painful, so you're having a painful sensation. Hyperesthesia means that you're having excessive sensitivity, okay? So it could be, this could be when you're having a real severe nerve problem and it is sensitive to the tiniest feather-light touch. That's an example of hyperesthesia. Paresthesia is an abnormal sensation. And now we're going to get into the 3 types of paralysis, okay? Hemiplegia means half of the body is paralyzed. We see this in stroke victims, usually. We don't see it in a whole lot of other scenarios, but that's one of the initial signs of a stroke, is that someone can't feel half of their body, okay? Paraplegia means the bottom half is paralyzed. Quadriplegia means 4 parts are paralyzed. So that's how you can remember that one easily. You have 4 appendages, your arms and your legs. That means everything is paralyzed from the neck down. The 2 differences between a psychologist and a psychiatrist, okay? A psychiatrist is a physician, okay? They can prescribe the medicine, okay? Whereas the clinical psychologist does not have the medical degree, so they cannot prescribe medicine, and they deal more with treating the individuals using counseling and therapy. That doesn't mean psychiatrists can't do the counseling and therapy, but most of the time, the people who administer the psychological tests and treat with the therapy are the clinical psychologists. So that's the difference between the 2 of them. PTSD is the abbreviation for letter B, post-traumatic stress disorder. So a quick review for the sudden deficiency of blood supply to the brain lasting a short time. These are called ischemic attacks, or TIAA, trans-ischemic attacks. Okay, so they're very brief, tiny little mini strokes is basically what happens. They can last 10 seconds, they can last 2 or 3 minutes. Sometimes it just appears that the person has passed out, okay? So what happens is the embolus occurs, so there's an occlusion of the blood vessel, there's a blockage, but it's only a temporary blockage. Somehow the embolus is dislodged and blood flow returns. So this is usually a precursor to a major stroke. So when they start happening more frequently, they will probably put the person on some clot busting drugs so that they end up not having a major stroke. This is an example of an EEG or an electroencephalogram. Okay. They're just measuring different brain activities at different times. Again, just to kind of show you different fun things that they do with the brain. So this is, again, an EEG, an electroencephalogram. Okay, so let's go to our patient statement and see what we can put together. Okay, I'm going to have you guys do the answering. So, Lindsay, you get the first word. Okay, a 70-year-old right-handed male presented to the emergency department with a right hemiparesis. What does that mean?
Is it
Don't be afraid.
bleed? Is it bleeding?
Nope, paresis means paralysis.
Mouse.
So what does hemiparesis mean?
One side.
One side. Good, 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 good. Okay. Miss Bai, you get the next one. They have expressive aphasia. Do you know what that one is? It's okay if you don't. Okay, aphasia means speaking.
Can't express.
Right, right.
So
Aphasia, right. Aphasia means they can't talk. So they're trying to tell you, expressive aphasia means they're trying to tell you, but they can't get the words out. Does that make sense? Okay. Okay. He has a history of hypertension and 2 years ago had a transischemic attack. Lolita, we just learned what a TIA is. Do you remember?
Transient ischemia.
Just little tiny mini strokes where the clot blocks the artery, but it blocks it just for a little bit and it keeps moving, okay? A computed tomography scan of the brain was negative for an intracerebral hemorrhage. Punya, intracerebral, what does that mean? Intra, do you remember what?
Between or within?
Within, good. Okay, good, good guys. So the neurologist was consulted and she confirmed the diagnosis of an ischemic stroke. Okay, ischemic means a blood vessel is blocked. And after an MRI, okay, it demonstrated an ischemic attack or ischemic area or an area that wasn't getting blood flow on the left cerebral cortex caused by a cerebral embolism. So embolism is blockage. Okay, there's two kinds of strokes you can have. You can have a stroke from a blockage or you can have a stroke from a rupture. Very good, guys, very good. Okay, so while in the emergency department, the patient had, okay, the inability to swallow and paralysis from the waist down. Did they talk anything about swallowing?
Oh.
No. Okay, the inability to speak. Did the patient have the inability to speak?
Yes.
Yes. And were they slight paralysis to the right side?
Yes.
Yeah.
Yes. So that's what we're going. That's where we're going. Good. So it's B. Okay. A diagnosis of stroke was made after an MRI of the brain was performed. Yes, we can say true to that. Okay. The patient had a history of I'm going to go back so you can see. He has a history of hypertension and 2 years ago had a transischemic attack. Okay, so the patient had a history of sudden deficient supply of blood to the brain. All right, guys, you guys did fantastic today. I will oh, I think this is the last time we're going to actually meet in face to face. So you guys have been troopers through this wild and crazy semester. That's all I'm going to tell you. Okay. You'll be hearing from me via email and via, your different assignments. But if you have any questions for the rest of the semester, let me know. Again, if you should have gotten the email to apply for the medical assisting program, please do so as soon as you can. Okay. And other than that, everybody stay safe and have a great week. Okay.
Thank you.
All right.
Thank you,
Bye,
bye.
guys. See you soon.